I don't see any English answers. I don't know what you're talking about, Akshi. Do you have any input? Okay, so here is what I will tell you. First of all, you do a really good job with the letter, and I love the concern. Like the entire letter speaks volumes of the concern that you have for the patients, and especially the Indian diaspora and the Indian patients where self medication is already pretty high, and we are able to falling for the branding and off-label use of various drugs, and especially since our population loves using antibiotics. Also, why will they stop here? It's a really good written letter. The only thing is the paragraph. Shouldn't. So your first paragraph should be an introduction about prevalence of obesity. So how big of a self-medication problem is this? Because right now our country is not really dealing with obesity. We're dealing more with malnutrition. That is about to change, you're right. Lifestyle disorders are completely, totally agreed on the rise, especially diabetes. How much prevalence of obesity and this is already there. So maybe you can add that as a reference or something. Then you can definitely include a bit more about the mechanism of action of the drug, which is fine. Yeah. So just in the first paragraph, a little bit about obesity itself, other drugs maybe, which are also off-label used for the same thing. If I'm not wrong, TCAs also are given for that. In the next paragraph, you can talk about the big risk that absence of proper guidelines pose. After that, your recommendations. What do you recommend? You only in one last line you have said lifestyle modifications is the primary method of managing weight. But in the last one whole paragraph, I think you can talk about different various methods that you know of to control weight, which can include, okay, of course, yoga, meditation, exercise, we're all aware of, but something else that maybe you can talk about to manage weight, appropriate diet or something that you know of. So one whole paragraph about that as a conclusion. Yeah, that's how I would structure the letter. But Sakshi's letter, let's talk about the positive aspects. It is nicely written in the sense that it communicates the message that look, the guidelines are absent. Secondly, she communicates well about the risk that off-label usage of drugs pose. She talks about the mechanism of action of the drug, and the letter is brief. It's not like by the end of it, I'm losing interest that, oh my God, what is she trying to say? It's not at all like that. So these are some very positive aspects of the whole letter. So the only thing I would suggest is a little bit of restructuring and one or two extra things about the prevalence of obesity. Because off-label use of Ozempic is not a big enough problem in my opinion, because right now we are a country dealing with malnutrition and malnutrition based conditions, especially in the lower socioeconomic strata, like tuberculosis, etc. We're dealing more with TB and those things rather than obesity per se. A little bit of introduction about obesity and its prevalence would also be helpful in my opinion.
I'll really take into consideration your feedback and make the changes accordingly. I have one more feedback that I would like to share with you after the class, and you can tell me how I can combine yours and their feedback, proceed with my paper, the letter to editor.
Definitely. And you can, in fact, it's a very well written one. You can even start looking for journals on where you can publish. Definitely look for one which is PubMed indexed. It should be like having some sort of an impact factor. And medicine based journals would be very good. This is a general medicine or an endocrinology article.
I got one suggestion in journal. It is the Indian
Yes.
Journal of Pharmacology. It is indexed by Medline. So that is one suggestion that I have gotten so far.
Now, next step would be if you've decided on, okay, you want to publish in a pharmac journal, an Indian Journal of Pharmacology, the next step should be, do they accept letters like this? Or do they only accept letters which are commentaries on existing articles? In that case, you'll have to modify your whole letter. So that's why before, when you select a journal, make sure that sort of article, that sort of letter is accepted by the journal. They'll have all this information on their website in the information for authors section.
Thank you, everyone. I would just like to add one thing is you can join the WhatsApp group, which I have put in the comment box. And if you prepare any drafts as such, you can share those drafts in the group so that anyone else can give comments on the draft. And in the next session, we can present the drafts or solve the doubts if you have any. If you let us know in the group.